Hello everyone, this is Dr. Jawad. In the short video, I'm going to talk about how increasing your vitamin D3 levels will benefit your body, especially around this time when we have a lot of viruses that we're trying to battle against, bacterial infections we're trying to battle against, and overall we just want to be in a better mood. Now, vitamin D3, it has a lot of benefits to the body. One, it acts as antiviral. It helps the immune system. It helps with the lungs. It helps decrease inflammation. Now, when I'm talking with a lot of patients and people in general, the first thing I want to know is what are your vitamin D3 levels at? What are we working with? Because most of the people are deficient in vitamin D and they don't even know. Now, the question is, who is the main target to be deficient? In no particular order. So you got obesity. The more fatty tissue you have in your body, the less it acts as a blockade, and so the less vitamin D3 you're actually going to absorb, which kind of bleeds over to malnourished. When you're not taking the appropriate nutrients, especially when you're taking in high sugar foods, when you're taking in processed foods, when you're taking in, not the best type of foods, it causes your body to be inflamed, but also you are not absorbing the vitamin D3 because the foods are broken down in the stomach and they're absorbed in the small intestines. And you need fat, proper gallbladder function to help break the fatty substances down to increase the vitamin D3. Darker skin. For some reason, people who have darker skin have lower levels of vitamin D3. Aging. Now, aging is very important because as we age, the one thing that we always have to look out for is the acidity in our stomach. As we get older, we actually decrease the levels of acid in our stomach. The acid should be between 1 and 3 for proper absorption. And as you age, a lot of people who are aging, they're on medications. They're on proton pump inhibitors. They're on a lot of medications which decreases the absorption of substances anyways. Winter months. Okay, I live outside Chicago, so we have three great months of the year. Think about it logically. When is the flu season typically? November, December, January, February. It's the winter months. We are not outside getting sunlight. Now, the sun is absorbed through our skin, but it's actually converted to the active form through the liver pathway and also works with the kidneys. So if we're not outside getting sun, yeah, sure, we're going to get deficient. Statins, statin drugs, antibiotics, proton pumps, PPIs, proton pump inhibitors. They are going to decrease the absorption of vitamin D3, and which also pre-existing conditions. So if you have a pre-existing condition, that may be due to the fact that you're deficient in vitamin D3, okay? So how does vitamin D3 benefit the immune system? There's many benefits, and I'm just going to talk about 5 of them. One, every cell has a D3 receptor, okay? Has a vitamin D receptor. Viruses in particular downgrade these receptors. So what happens? They downregulate the receptors, so you're not getting you're not absorbing the vitamin D3, which will benefit the immune system. So depletion dysregulates the immune system, because remember, vitamin D3 is phenomenal for the immune response, which will help lower inflammation. So again, depletion dysregulates the immune system. It does it by modulating. It modulates the inflammatory response. We have like an on and an off switch, and those are cytokines. Cytokines are designed to basically sound the alarm to the body to say, hey, we're inflamed, something's wrong. They're pro-inflammatory and anti-inflammatory, okay, cytokines. And the problem with, especially with viruses, the COVID, you hear about the cytokine storm. Because again, remember, vitamin D3 modulates the inflammatory response, and that opens you up for the cytokine storm. And then this is how a lot of people are getting all these reactions with the COVID, because COVID is designed for the lung tissue, okay? Again, for the lungs. So deficient in vitamin D3, yes, it's going to the virus in itself is going to target the lung that much more, easier. It has antiviral properties. Low levels of vitamin D increase the risk of acute respiratory distress syndrome, which again, the COVID targets the lung cell through the ACE2 receptor. And once it goes in there, it acts as a doorway in and it causes a cytokine storm, okay? So low levels of vitamin D3 will increase the risk of any type of respiratory syndrome. So the question is, so what's the dose? Now, let me just skip over the dose to the foods, because I always say first, let's clean up the gut, let's clean up your foods, take away the wheat, the gluten, the dairy, the soy, the sugar, and replace it with good stuff. Cod liver oil, 1 tablespoon, 1,300 IUs of vitamin D3. 3 ounces of salmon, 447 IUs. 3 ounces of tuna, 154 IUs. Beef liver, 3 ounces of beef liver, 42 IUs. 1 egg yolk, 41 IUs. Now, my recommend dosage, if you're not living in a sunny area, is 10,000 IUs per day. Now, that may seem like a lot, but it's actually not. 1 sardine, 23 IUs. So again, if you want to go the food route, yes, please do. Okay? Now, 10,000 IUs daily, because when I'm testing people, I want their levels at least above 50. The higher you are, the better off it's going to be. It's going to help their immune response and your mood. I hope this helps. Please leave a comment or a question down below. Hope you enjoyed the video, and I'll see you the next time. Thank you.